Hi, everyone. We are here again. Hi, Doctora. How-
Hola. Hello,
Hey,
everyone. Good afternoon, good morning, good evening, everywhere globally. You're
exactly.
watching.
We don't know where people are right now, but we are here. I'm in Savannah,
Yes.
Georgia, and you are?
My name is Doctora Flora Luyando
And where are you right now, Doctora?
in Nueva York, in New York City.
So I'm here in Savannah, Georgia, and we are going to continue talking about cancer awareness. We already talked about cancer, colon cancer, but today we would like to talk about the breast cancer. And people know somebody in this world, you know somebody who has been affected by that, who's concerned about it. Even till today, I have many questions. And what can we do? What are the symptoms? How can I tell how I might be going through cancer or breast cancer? Tell me a little bit about more about that.
Well, as I always tell everyone, I like to keep things very, very simple. And one of the things that, again, with any kind of cancer, inflammation is one major sign. So if you're starting to feel puffy, and if your body and your breast, specifically, since we're talking about breast cancer, and it's
Mhm.
February 1st, awareness of breast cancer. I'm glad to be here to discuss this with you. But yes, inflammation, tenderness in your breast area that is also extending underneath your armpit. It could be on both sides, it could be on one side, unilateral, but it's a feeling that you've never felt before, and it is a continuous feeling, and that's a major sign right there. Second, that you may have a irregular shape around your nipple area, or on your nipple, where cancer, it's not a well-formed shape. It's a
Okay.
irregular shape. A certain kind of rash that doesn't go away, very scaly, very itchy, very dry. Um,
Rash.
yes, it could be around the nip or underneath your armpit or on your side. Because depending how big your breasts are, it can extend all the way to the side of your ribs, because some people's breasts
Yeah.
flow down.
Mm-hmm.
So don't limit yourself in saying just up here. It can extend all the way down underneath, depending how large your breasts are. And let me be very, very clear that it just does not affect women. It does affect men, but there are higher cases and found in women. So men, if you are feeling that, please do not avoid that it may be breast cancer. Um, Also, daily checkups with yourself, self breast examination, feeling any nodules, any lumps that weren't there before. Now, don't get caught up that if you feel something, it could be non-cancerous, it could be a little cyst, but it's always safe than later on that it has spread and now you're in stage 3 or stage 4. Prevention awareness is more important, and that is why I'm so glad to be discussing this with you, because most people, what happens is they avoid these signs either through fear or not taking time for themselves, or they don't go to regular checkups in doctors, and we have to start being very, very, very diligent on that. Corona has shown that health is so important,
Yep.
so those are signs that I say definitely go and get checked.
You're talking and I'm thinking about this. I'm guilty of charge, as how you say it. I don't check my breast, frequently. And by you talking to me about this, it's like, hello, you are doing an interview, you're talking, we're having this discussion, and I don't do that. So for all the women, I'm 63. So yeah, I'm past 50.
You look good. You look good.
Thank you. I'm past 50. So you know what? So I'm going to put like a sign on my mirror. Another thing that you were mentioning that I thought about it, how many of us don't look at ourselves? Talking about the shape, because the pain, yes, the inflammation, the soreness, I can see that, happening. Okay, I have it's sore here, but the shape of the nipple, no, I don't. Do I look at my nipples? So if you're listening to this conversation, please pay attention to what the doctora said right now, because it's important. And another thing I was thinking about age. What age does this?
Well, it actually hits the young, it hits from the 20s, 30s and up now,
Really?
so it's really affecting the community all over. And it's actually this breast cancer is the second highest cancer that is killing women more so than men, because it's higher found in women. But yes, it's the second type of cancer that is killing in the United States.
I was thinking also, thank you for that. I was thinking about, how people are under stress,
Mm-hmm.
how that can affect, breast cancer or cancer in general.
Mm-hmm. Well, like I've mentioned to many people in my office, and I've had opportunities to help people recover from cancer, or going through cancer, or going having chemotherapy, and they also come to me
Mm-hmm.
to continue to boost their energy. One of the important things that I highly recommend is also seeing someone that's in a alternative medicine as well, with the combination of Western. I highly recommend that to all my patients. Again, I come from a Western background, but I combine both. I have much respect for both. But there are certain things that each profession
Mm-hmm.
may not know. But when you combine each other and you work as a community, then everybody gets benefits from that, and especially the patient. Acupuncture that I do specifically, it's an amazing medicine to help boost after chemotherapy, helping that fatigue, that dragness. Also, herbs. We have specific herbs that can help against
Perfect.
cancer, which, as in prevention, or as in helping you as you have cancer. It boosts your immune system. We also have dietary foods that are very simple that we can make at home. I will keep it simple, but there is a long consultation, because you got to keep it general, because not
Exactly.
every person that's going through cancer can, oh, let me do this, do this. It's gotten to the point that a society is just Googling. You have to see a professional that knows their stuff. And if you don't mesh with a particular practitioner or a doctor, then keep in mind, it's not the medicine, whether it's Eastern or Western, it may be your practitioner, because this medicine have been around for years. So just change as quick as you change a GYN doctor, you can change your naturopathic doctor or your acupuncturist, and fit right for you. One of the things that's also helpful in just, trying to stay as healthy as possible is, when it comes to breast cancer, eating green leafy vegetables,
Perfect.
carrots, antioxidant vegetables, such as red peppers and cayenne peppers, help reduce that, because it has plenty of things that help fight cancer cells.
And I love that, because
Food is medicine.
yeah, it is. I remember my grandfather giving, boiling some plants, and we were never constipated. Our skin looked really good. So a combination of both, I like that. And I like that we can reach out to you in different ways, because I understand that I can do a Zoom.
Mm-hmm.
I can be in Savannah, Georgia. You can be in New York, and I can have a consultation with you.
Absolutely. I do telemedicine as well. I actually been doing that way before they call it telemedicine. The times when they had Skype, remember everyone that had Skype? It's like, what is that, right? But yes, I've been doing this type of medicine for years, and been doing energy work over the phone and helping people
Yeah.
with their illnesses over the phone, computer, Skype, and now Zoom. We call it Zoom, and telemedicine. But yes, I have many patients that I've helped before coronavirus, with illnesses, with energy work. And I am thankful and grateful to have you, Suma, because, for so long, I didn't discuss those things. And I really believe more now than ever, having that platform and allowing people to know that I am capable to assist in these things are important. you can do wondrous things virtually. And I say this in a humbling way. Let me be very clear. I used to be a shy girl, and I always did things with action. And yes, I always spoke up. Being in a Puerto Rican family in the South Bronx, you can't be too shy. You know what I mean, Zulma? I have a voice.
Yeah.
I wasn't in the closet, but what I'm saying is it's more important now that I'm so grateful to have a platform, with Corona, and way before Corona occurred, COVID-19, I promised to say, I want to speak a little bit more about this wonderful medicine. I'm seeing a difference. Especially seeing Eastern and Western combined, I'm seeing a difference in the work that I have done. I've seen people come into my office that could not walk, and now they're able to walk. And these are testimonies from them, too, where people were about to commit suicide and they came to me and I helped them with anxiety and depression, or reduce their medication with a combination of herbs. And I'm so grateful to say these things because I want people to understand that there are options, and I am here to help as much as I can. And I'm glad that I have a platform to do it globally as well.
That's one of the things that I think that brought us together, because I work with herbs too. I do energy work. There's no better satisfaction to see somebody coming to you ill, and what like you're saying, not able to walk, and now there's walking. Sometimes when people say, I went to the bathroom, and I say, yeah, I'm like, it's something that people don't say out loud, in front, at a mall, in a mall. But when you're working with people's illnesses, conditions, diseases, you go like, yes, it's working. Yes, we are making a change, a difference in people's world. And I thank you for that. And we are like sisters by now.
Yeah.
we have to come to Savannah to visit. So you can find Dr. Flora. Please give us your website.
You can find me at florahealing.com, florahealing.com. I also speak Spanish for the community that also wants to speak in Spanish. I am here for that.
That's true.
I welcome everyone.
Well, but if they didn't know by now, they already know that we are completely bilingual. Sometimes I was like, am I bilingual?
Because it's so natural for us. So we forget because it's natural. We speak Spanish and English and sometimes Spanglish.
Spanglish. So I know also, honey, before we leave, okay, doctor, you are in Africa, you do work in Africa, in Puerto Rico. So please go to her website as well, because she has different events constantly. You're moving and shaking it and all over. And like, that we were saying in the other video, please look for her. And if you are, those people that like to help others like we do, please contribute to Africa and to Puerto Rico. And is there any other places that you, raise money and contribute besides Africa and Puerto Rico?
As of now, it is Puerto Rico and Tanzania, Africa and South Africa. But yes, I have contributed to local areas in the United States for domestic violence women. I have done that as well.
Wow.
Locally in the United States.
That one I didn't know. So with this, we are going to leave you. We're going to keep it together as short as possible. But thank you for being here, Doctora. Thank you for the audience to be here. Have a blessed day and be happy.
Thank you, guys. Stay aware. I'm glad it is Breast Cancer Awareness Month. Please check yourself. Peace and blessings. Bendiciones.